Hi guys, this is Dr. Bhupesh once again from Dr. BKM Institutes as usual at your service, and please subscribe our channel if you have not until now to get the best OET videos and to understand what OET is in the simplest of the way. Again, the purpose is to make OET the easiest test of the world. Now, considering one thing, if I would like to explain you about this writing is fabulous. Actually, this was again. I normally say I started OET, 10 years ago, 11 years ago. It has been very long time, and this letter was the first letter which taught me about OET, because when I started teaching OET, I didn't even know why data selection is important and how to select the data. So I used to be very good at grammar, which I normally teach. Even the last week we had grammar discussed 3 times. So obviously, being a doctor, coming from a medical professional, having a very good grammar, I thought that I was very appropriate for OET. But then this letter came, and then I understood that in OET, data selection is also very important. Means grammar should be fine, purpose should be fine, then you will pass 100%. But then came the challenge of data selection as well, that you have to restrict your word count maximum to 220. But when I wrote this letter for the first time, I wrote 350 words. Gosh, I was scared as well, because in OET, we are allowed to write only 200 words. Now, this letter. And then I started understanding what OET is. In this letter, what is happening, I will tell you in very brief. What is happening is that, first of all, you always start the letter from the end to know to whom you are writing the letter. So using write a letter to Dr. Smith at the Royal Melbourne Hospital, expand do not use this and this. So I'm writing to a doctor. That is the main thing. Then last visit is always the most important visit. Means if a visit letter comes to you and it is a very big letter, this is the visit you cannot miss, because this is the visit that will tell the purpose. Now see the purpose. Refer to GI surgeon. That means Dr. Harry Smith is a GI surgeon at Royal Melbourne Hospital for assessment of operation. That means whether the patient needs operation or not, for the assessment of operation, which is fund application. Now patient is asymptomatic, patient has become better, but continue to take omeprazole, but he has to take antacid every day. Omeprazole most probably is an antacid. Okay, so he has to take antacid every day. She wants to stop therapy. Taking on board lifestyle changes means she is making lifestyle changes, like she has stopped smoking, but she is worried to take tablets for the rest of the life. That is the problem. Omeprazole is keeping her better. She has improved, but now the problem is that she doesn't want to take omeprazole. So maybe that is why, maybe again, I don't know, because I am a dentist. I am not very good with this thing. Even now, I do not know. But yeah, the main purpose is assessment of operation, that is fund application. So if I have to write this letter, so I will simply go to my pages. And if I have to write the first paragraph, let's see what is purpose. See, this is how easy the purpose is. Okay. That means I don't have to read even the complete letter. I'm writing to doctor. So the first paragraph I would write is, see how easy and how much time does it take. This letter is being written regarding Mrs. Clooney, I guess. I don't know the name of the patient. I did not check it, but whatever, we will change accordingly. Who is being, this letter is being written regarding who needs assessment for operation, that is fund application. Therefore, she is being referred under your expertise. Easiest way of passing OET. I do not like this way too much, because I believe the person who is writing this way is trying to play safe. Means, of course, that person will pass, because this is an average way of writing. But if I would have been there, I would have told about Miss Clooney. This letter is being written Miss Clooney. My method is, who was diagnosed with this thing. Now she is better with the help of her medications. This is my way, that in the first paragraph only, I would like to make examiner feel that my grammar is good, my purpose of writing is clear. That means I know about letter, and that I can do it with first. I'm showing the grammar was plus third for, that means in the past the main problem was this. Now she is better, or we can say after treatment she is better. That is the progress. After treatment also I can route. She's better with the help of medications. But now she wants to stop her medication. Now she wants to stop her therapy. Stop her therapy and needs assessment. That's it. And needs assessment for operation, that is fundoplication. If you want to remove it, you can remove it. There is no problem. Don't make it complex. This letter is being written who was diagnosed with this. After treatment, she is better with the help of medications. But now she wants to stop her therapy and needs assessment for this. Therefore, she is being. The only thing that is, but she is better with the help of her daily medications. I want to make this word also clear that she has to take daily medication. That is what is causing the problem. But now she wants to stop her therapy and needs assessment for fund application. Therefore, now this is better as per me because it tells the complete thing about a patient. Akjinder ma'am, maybe you are sleeping, but your mobile is moving. So you have to take care of these artistic things. Or AK, I'm not sure whether it is you or somebody else. Okay, this letter is being written. So now it is a complete. But if you want to play safe, then this is not a problem. Simplest, easiest way to pass. Word count would also be restricted because you need to say, I have told you this letter is very big. Now the main purpose is clear. Now focus on the letter. Now start reading letter. Patient name is Lucy Clooney. Date of birth 1955. Bank manager, heavy smoker. Drinks alcohol occasionally. Mild hypertension, but not taking any medication. Moderately overweight. So that means patient is obese and bank manager having so many responsibilities. Smoking every day. 20 cigarettes daily. 30 years. Subjective. Discomfort in upper abdomen on 18th August. Burning sensation at the same area since her 20s. There is burning sensation. Difficulty in swallowing solid food. So there are problems she is having with her tummy. Burning sensation. So it's basically, you can say acidic tummy, gastric tummy, acidic. Objective pulse rate is thick, blood pressure is okay, no cervical lymph node, nothing. So objectively, everything is okay. Then we said if there is nothing objective, so that means you must be having dysphagia. That is the problem you are having, dysphagia, due to either hiatus hernia or other organic lesions in the, or there are lesions in the esophagus. Explain the possible diagnosis, advice to stop smoking and to adjust her lifestyle, to consider further investigation and come back for review after 2 weeks. But she did not come. She came after 3 months. See, August, then directly in November. So we told her to come after 2 weeks, but she did not come. Symptoms worsened, increasing difficulty, undigested foodstuffs. Examination, everything was normal, but hiatus hernia again. Okay, so we said after 3 months you are having same problem. So this time we request you again to go for endoscopy and biopsy. Then in the third visit, she came. Symptoms did not improve, cough at night. And on examination, endoscopy, esophagitis. There is an inflammation in the esophagus. Incisor teeth, small hiatus hernia. Biopsy consistent with, that means biopsy also confirmed the same. So we said your assessment is bad. This is the main thing about this letter. Otherwise, normally letters are until this. Letters are normally, there is no data given. Then though you can mix up the first 2 visit and last visit you can write. But this letter is different. Now this is what I'm telling you special about this letter. But this letter is different because in this letter, we are not writing that I'm writing this letter regarding this patient who has been diagnosed with Barrett's esophagus. Therefore, she needs your expertise. No, no. Barrett's esophagus has been found. When it was found, today is 23rd January. Today is 23rd January. Barrett's esophagus was found on 25th November. That means November, December, and now January. In 2 months, I gave her the treatment, being the doctor or the nurse at the hospital. So with my treatment, she's better. So please understand this letter changes because the problem is not Barrett's esophagus, because I have resolved the problem of Barrett's esophagus with omeprazole and giving medications and lifestyle changes. The problem is now she wants to stop therapy. So she needs assessment of fundoplication. That's why we are referring. So in this letter, nothing matters. Means now the first two visits do not matter too much in this letter. Because the main problem is not Barrett's esophagus. The main problem is Barrett's esophagus has been cured with the help of medications. But it is the continuation of the medication that is the problem. Please understand this topic, that normally if you will get visit letter, this visit will not be there that patient has improved. You will write that patient has not improved. Patient is now has been diagnosed with a Barrett's esophagus, therefore he is being referred. But in this letter, the patient has been treated. But the problem is that he does not want to. So my purpose obviously will become this letter again. Purpose, this letter is being written this, who was diagnosed with Barrett's esophagus 2 months ago, 25th November, 2 months ago. After treatment, she is better. This is line is not suiting, so I will say now. Now she is better because I'm using medication. So medication is also treatment. That is why fluency is getting disturbed. So now she is better with the help of her daily medications. But now we don't know now, but she wants to stop her therapy and needs assessment. Now this is better. This will go in flow. So this is the main. Now, whatever you write in this letter is not a problem. Like Miss Clooney, main word is a heavy smoker. This is the letter for this. I taught you one thing, that the people sometimes do it wrong. The person who will write is a heavy smoker is wrong, because she used to be a heavy smoker. Why? Because now she has quit smoking, stopped smoking. This is the tense that will give you marks. She used to be means she was a heavy smoker. Used to be a heavy smoker, but now she has quit smoking. This will give you marks. So small things give you marks. And there was nothing important. Bank, yeah. Then simply, I will go to the visit because there is nothing special in this letter. So I will directly, on 18th August, she presented for the first time. She presented for the first time with main two symptoms, with difficulty in swallowing solid foods. That's it. With difficulty in swallowing solid foods. And at that time, simply don't write anything. At that time, dysphagia was diagnosed, question mark, or assessment. Okay. At that time, dysphagia was assessed. Again, when assessment word is given, write this word only, was assessed. Or word is given, so dysphagia or organic lesions. Dysphagia due to hiatus hernia. I will write it either. Dysphagia due to hiatus hernia or organic lesions in the esophagus. Now I am telling you again very important things about this letter in esophagus. When there are two words and or word is given, then suspected word becomes the best word. Because see, dysphagia either due to this or other organic lesions means the patient was assessed. Otherwise, you can say dysphagia was assessed. Okay, let's not make it complex. Either due to hiatus hernia or organic lesions. Let's make it simple. So dysphagia was assessed. Yeah, in this we can do this because they are saying dysphagia due to hiatus hernia or organic lesions, but dysphagia was there. Okay. Small things. So maybe I have to remove this. She used to be a heavy smoker. She was advised. Again, connectors. You say connectors are important in every line. No. She was advised to quit smoking. She was advised. What happened? She was advised to quit smoking and to come back. Weeks. But she came with what? Now I'm mixing up the visits. But she came up with worsened symptoms after 3 months. Then she was advised. Now simple. Then she was advised to undergo whatever the two important biopsy and what was the other thing? Biopsy and endoscopy. She was advised to undergo only right important thing, endoscopy and biopsy. Now simple on 20th November. Her endoscopy revealed, simple again, her endoscopy revealed this, which was also confirmed by biopsy. Because they were saying consistent means endoscopy also said same, and this, which was confirmed by biopsy as well. Now this is English. Now I have used the connector and have made two lines together, which was also confirmed by passive voice by biopsy as well. All good. Over. Now you are saying further she was assessed with Barrett's esophagus. Barrett's esophagus. Now, as the word count is more, so I would advise don't write it over here because now it will repeat. So maybe that way is better. We can avoid the data over here. I will add in here. She was assessed with esophagus and was advised to, okay, and was advised to take medications. Medications along with lifestyle changes. She was advised to take medications and to make lifestyle changes. This is better to make, but along with lifestyle changes, along with making lifestyle changes. Now this is better. So today, or you can start with now even, because this is the last visit. Today, she is better. She is better with the help, but she wants to stop her therapy. And hence, your expertise is highly required. Now, if you will see, total time I have taken is 29 minutes, maybe less than 20, maybe 20 minutes only. And my letter is all done. And let us check the word count as well. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21. Around 21 lines into 7. If I say 21 into 7, it would be less. It should be more words, obviously. But 7 ones are 7, 7 to the 4. It is around 150 words. So I can write more. Means I can explain more things. But still, I think word count should be more because in this line, if you will see, there are almost 9 words. In this line, I would say 4 and 4, 8 words. In this line also 7 words. In this line, there are 8 words. So majorly 8 words are there. So 8 into 21, if I do 167 words. It would be more than that though. But yeah, in 167 words, I can get it done. Now I will revise. If I have missed anything, then I will see to it. If there is anything that is specific, means, oh, in this line, I have also forgot. Okay. I did not talk about no smoking. Smoking word is missing. That's why the letter is in. Used to be. Okay. Today she is better with the help of but medications. And also she is making lifestyle changes. That is the improvement. In addition, she has quit smoking. See, the word count will automatically improve. But now she wants to stop therapy. Now the word count will be perfect, letter is perfect, everything is complete. That is what exactly OT says. If you're writing too much, if you're writing more than 200 words, OET says, but 210 and 220 is fine. If you're writing more than that, that means you are taking unnecessary data. If you're writing less than that, then like me, maybe you are missing something important that you have forgot to tell that she has stopped smoking. So I forgot to talk about this thing. So as soon as I do this, then my line becomes perfect. 4, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 70 words. 1, 2, 3, 4, 5 must be around 40 words. 1, 2, 3, 4, 5. Again, 40 plus 40, 80 plus 70, 150 plus around, if I say 30, perfect words. This is how simple you write it. Write only important things. Smoking, she has quit the smoking. Dysphagia was the main thing that she came up with. And always recheck your spelling. Due to either this, she was advised to quit. Then she was advised to undergo biopsy. This is where I have mixed up. That is the main thing. She did not come, but she came with worsened symptoms or worsened condition. If you don't want, again, if you don't want to write worsened condition, we'll cover everything. Then she was advised. Then means after that. After that, I cannot write again. And you can use also after that. Now means now, then means then at that time. Then is equal to at that time. Then is equal to at that time. Then she was advised to undergo biopsy. On 20th November, her biopsy revealed esophagitis or hernia or whatever was given. Esophagitis, which was also confirmed by biopsy. Further, she was advised further, or you can say, simple. If I have to change this, assessment of Barrett's esophagus was made. This is to change the tense, just to change, because bar you would be writing the patient was assessed with. So you can say assessment of Barrett's esophagus was made and she was advised. Then you have to write she, because now the subject is changing. Assessment of Barrett's esophagus was made and she was advised to take medications along with making some lifestyle changes. You can also write some over here. So when you check it, it becomes better. So today she is better with the help of her daily medication. Also, she is making lifestyle. In addition, she has quit smoking, but now she wants to stop her therapy. Now this is getting bigger. Your expertise is highly required in this case. And would be highly appreciated if I want to write, and would be highly appreciated. Whatever, again, small changes I can make. So this is further makes it better. In addition, she has, but now she wants to stop it. So your expertise is highly required. Simple. Or if you want to repeat this line as well, fund application, then you can say, but now she wants to stop her therapy. Your expertise for assessment of fund application. Now see this, it is becoming better. Now, again, we are just changing the way of writing. Again, just try to learn this. Your expertise for this thing is highly required for assessment of fund application. Is now examiner will give you lot of marks because he will see in the first you have written who needs assessment, patient needs, and now you have written passive voice. Your expertise for this thing is required is plus third form passive voice. So this is the way to write. Again, don't just listen to it one time. I would say copy paste this letter 3 times. Copy paste. Or you can do one thing. You can listen to this letter 3 times to learn grammar. In the first time, you will learn the word count control. Second time, you will learn how we are managing the data. Third time, when you will listen carefully, you will learn the grammar as well. Learning until grammar is very important. So again, just a lecture of 30 minutes can change your writing forever. Choice, obviously, as always, is yours. This is Dr. Bhupesh from Dr. BKM Institute. Thank you.